We just saw a graphical representation of COVID data taking into account the top 20 states daily, state-wise. Now, Dr. Sucharita, what do you think about this bar chart?
Dr. Pradeep, the graphical representation of this data is a visual treat. Where did you collect this data from? Did you compile it yourself?
No, compilation of data by one individual would have been very difficult. This bar chart needs individual data of every state, every date to be entered into the Flourish app. I was able to get this data from prsindia.org. It is still available for download from that website. Now, doctor, as a doctor of community medicine, as a specialist in community medicine, what do you think is the significance of this bar chart?
This is actually crude data showing actual number of cases infected in a particular state. Nothing much can be inferred from this data point. For example, on March 25th, from the data projected in this bar charts, it was shown that in the state of Tamil Nadu, there were 26 cases reported. So it means on that particular date, there were 26 cases of COVID in the state of Tamil Nadu. Similarly, on the day of 2021, March 26, it was reported to be 8.4 lakhs. So it represents the actual number of cases existing on that particular day.
Okay.
It does not give anything more than that.
Okay. Anything more than that in the sense it doesn't give us any inference on how good a state's control was or on what the actual disease burden of the state was.
Definitely, because that actually requires more parameters for us to actually comment on how the state has performed effectively in controlling that particular pandemic.
Okay. But every media that we are exposed to takes only this total number of cases into account, and they claim that a state is doing excellent or a state is doing bad just based on one such data, just based on total number of cases. So that was one of the inspiration for us to come up with the series of bar charts. But one thing this total number of cases, this bar chart does show is the virulence or the ability of the virus, of this little virus, to infect an entire population. Now, we can get that from, if we look at the top 5 states. The top 5 states are Maharashtra. As on Feb 25th, 2021, they are Maharashtra, Kerala, Karnataka, Andhra Pradesh and Tamil Nadu. Now, as on Feb 25th, the total number of cases in Maharashtra was 21 lakhs. Now, we have to remember, if we take into account Feb 2020, the number of COVID cases would have been 0. So just within a year, the number of cases has increased to such a fold. Now in Kerala, it has increased within a year from 0 to 10.4 lakhs. In Karnataka, it is 9.5 lakhs. In Andhra, it's 8.8 lakhs. And in Tamil Nadu, it's 8.4 lakh of people who were infected by this virus. Now, another interesting data is from Lakshadweep. Lakshadweep, I'll just play the video of the least number of states affected. Lakshadweep actually didn't report a single case for the entire year of 2020. The first case of Lakshadweep, which was recorded to be COVID positive, was on Jan 18th. Okay, and within 1 month, so from Jan 18th to March to Feb 25th of 2021, within that 1 month, the virus was able to infect 322 people. Right now, Doc, what do you think is the best way for us to assess a state's actual control or the disease burden, or how good or how bad a state has been doing?
That's an interesting question. The total number of active cases which are present in a state is a better indicator of assessing these parameters, and how a state actually controlled the infection can be assessed by the number of active cases present in that particular state. This is a better indicator.
Now, what do you think about state's population? Do we?
Definitely, because in a country like India, with the vast differences according to the state's population densities and distribution in rural and urban pockets, these parameters definitely influence how the infection rates and dynamics of transmission are distributed. So, definitely.
Yeah. So, like you said, I think our next bar charts should be on number of active cases and percentage population based on each and every individual state.
Definitely.
I think that will give us a better measure on how good or how bad the impact of COVID was on these individual states.
Sure.
We'll try working out the data. I'll publish it soon, with
Yeah. So our next episode is going to be on the percentage.
possibly on the percentage or on the total number of cases according to state.